My name is Dr. Sarah Sawaf. I use she, her pronouns, and I am a member of the Riverside County Suicide Prevention Coalition Higher Education Subcommittee. The purpose of this video is to provide staff and faculty across campuses with tips on how to support students in distress using the acronym VICKS. VICKS stands for Validate, Identify, Care, Knowledge, Support, and Self-Care. This video includes a role play of a 26-year-old first-generation student in distress going to her academic advisor for support.
Hi, how can I help you?
Hi, I have an appointment to talk to Dr. Sullivan.
Okay, sounds good. My name is Connie and I would be happy to help you and walk you to her office. Does that sound good?
Yeah, sounds good, thank you.
The student is struggling academically and at risk of being dismissed from her program. As a first-generation student, she feels pressure to do well. She is worried about what her family will think if she drops her program and doesn't want them to be disappointed in her. The student came to her advisor for support and to confide in her.
Hi, I'm Dr. Sullivan. Feel free to sit down. Hey, Hannah, thank you for coming in today. How are you?
Hi, I'm okay. One of my professors referred me to come in to talk to you about academics. To be honest, I'm not really sure why I'm here.
Well, I'm glad that you're here today, and we could definitely talk about your academic challenges. But before we do, I noticed you seem overwhelmed today. What's going on?
Yeah, to be honest, I'm just really struggling. I feel like I don't fit in here in my program. I just don't really have anyone to talk to, and I'm starting to get worried that I won't be able to complete it.
That makes sense. Well, thank you for sharing that. College is definitely challenging, and it seems like you're going through a lot right now. I want you to know that everything you're feeling and experiencing is normal, it's valid, and it's okay.
As you see here, the V in VICKS is for validation. Validation can come in simple statements that help students feel seen and heard. All you have to do is be genuine, express empathy, be focused and present in the conversation, and reflect what you hear and see without judgment.
Thank you. I'm really trying my best. I feel so much pressure from my family. I'm the first of us to go to college, and my parents are just really counting on me to really finish this program, graduate, and help support them ultimately. And at this point, I just don't know if I can do it. I've honestly been thinking about dropping out.
That's understandable, and it sounds really stressful. It seems like the pressure is impacting you, impacting your academics, because you really care about your family. When I've worked with first-generation students in the past, I've noticed many of them struggling with similarities, just like you, but also struggling with asking for help and finding support outside their families. Is that something you're struggling with?
The advisor continues to validate the student and moves into identify, noticing out loud and expressing their concerns and observations. The advisor identifies the pressure and first-gen experiences as possible sources of stress and checks in with the student to see if they have identified the challenges correctly.
Well, I've always kind of done things on my own. I'm the oldest out of all my siblings. I can't really lean on my family because no one knows what college is like. And they don't really understand. And I haven't really made any connections at college in my program either. So I'm just feeling really stuck.
So I understand that this experience can be really difficult, especially when you feel like you don't have support from anyone. I'm glad you came in here today and you're trusting me with sharing this information. I love to connect you with appropriate services on campus that can help you navigate these stressors. How does that sound?
C is for care. The advisor communicates their care for the student and their intentions to help support the student with campus resources.
What would that mean? Is that like going to the health center or seeing a counselor? What does that mean?
Yeah, there's a lot of amazing resources on our college campuses, and depending on the college campus, every college offers something differently. So I want to explore some of those options with you. Is that okay?
K is for knowledge. This is the moment to share your knowledge of available campus resources to support student mental health and well-being. Whether you have a counseling center, health center, or other well-being resource, stay up to date on what your campus provides and share it with your students.
Because I care about you, I want you to know that you're not alone. I want to connect you again with additional support on campus so we can walk over to our well-being office together to provide more support for what's going on. How does that sound?
Okay, I'm kind of nervous to go alone. Is there any way you can come with me to do that?
S is for support and self-care. We will now show you 3 different options the advisor can offer. Option 1.
Absolutely. I have some time right now, so I'd be happy to walk over with you.
Okay, that sounds good. Thank you. I really appreciate you listening and supporting me with this.
Option 2.
Okay, I'm a little nervous to go alone. Can you come with me?
Unfortunately, I won't be able to walk with you right now at this moment, but we can call together before you leave my office, if that's
Yeah,
okay.
That sounds good. I appreciate that. Thank you.
And option 3.
I'm a little nervous going alone. Is there someone who can come with me?
I have another student meeting right now. However, I can ask someone from my office to walk you over. Would that be okay?
Yeah, that would be good. Thank you. I appreciate you hearing me out and supporting me with this.
You're welcome.
For your self-care when supporting students, be mindful of your own boundaries, time, and capacity. Don't overcommit, offer what you can feasibly do, and be sure to practice self-care. If you have the time, you can agree to walk over together or call together. If you're not available, ask another team member to assist you if that's possible.
Hey, Connie, can we go for a walk?
Hey, yeah, of course, I have a few minutes.
Perfect.
You can also offer to schedule a time when you are available with the student, and/or provide the resources and information and schedule a time to follow up to see if they reached out. Remember, you are not alone. The Riverside County Suicide Prevention Coalition and your campus resources are here to help. For more information, please reach out to your respective campus resources for support.